Okay, I know I'm gonna make some people mad with this video, but I have to do it. Things that I wish people would know when they came to the labor and delivery unit. It would be very helpful if you knew not to come during change of shift, or to just be mindful of when our shifts are changing as nurses. So usually we start work at 7 a.m. or 7 p.m., day shift, night shift, and then we end 12 hours later. So during change of shift just gets crazy because all the nurses are talking about the patient and giving report to the next nurse who's going to take over that patient. And so it's loud in the nurse's station. And then if we're getting calls on the call light or phone calls or people coming out to the nurse's station to ask for things, it just gets crazy. Of course, if there's an emergency in your room or whatever, like, call us. And if it happens to be a change of shift, like, you can't help that. But if you can wait, then wait until after like 7:30-ish. That's usually when things kind of calm down and we get our bearings as nurses. Did you know that you don't have to listen to everything that your doctor says? You can actually disagree. You can ask for more time to think about something. You can ask for time to discuss options with your partner. And sometimes it's just their suggestion if they are strongly recommending something because of your specific situation, and that is the best thing, then by all means do it. But you have the option to say no sometimes. Also, if you have a scheduled induction or when you plan out with your doctor that you need medication to start your labor, like, we don't necessarily know what that specific day or shift is going to look like, and sometimes it gets crazy. So scheduled inductions are not our first priority all the time. So if you come in and your scheduled induction is for 9 p.m. or 6 a.m., whatever, and no one is attending to you right away, it's actually for your safety. The nurses are assigned to other patients, and we're trying to manage the floor, whatever's going on at that time. So we'll do our best to kind of get things started, like get you hooked up to the monitor, get you in a gown, get you in bed, get some water, but we might not be able to start the medication right away. So please be patient with us. Another thing is, you're probably not gonna sleep very well at the hospital. The nurses we're always going into your room, we're adjusting the monitors, we're checking on you, we're checking on the baby, we're bringing you water, we're bringing things into the room, we're getting everything set up, and the beds aren't very comfortable, unfortunately. Actually take off the foot of the bed so that the doctor can get really close, and then the mom's legs are up in stirrups. So the beds are not very comfortable. Also, know your GBS status. GBS is group beta strep. I talked about this in the medications video, that they usually test for this around 36 weeks gestation. And it's a bacteria that sometimes is in your vagina, and if you have it, then we need to give antibiotics. It's good if you know yourself, so that if we don't have your prenatal records, which sometimes we don't, that we know if we need to ask the doctor to have you treated or not with antibiotics. Another thing I wish people would know is that your doctor has a life of his or her own, so they're not going to be at the hospital when you get there. The nurses are definitely there, and there's usually a laborist or a doctor in the hospital who kind of covers any emergency case or is there to assist with deliveries or answer questions for someone who doesn't have an assigned doctor. But your doctor, if it's the middle of the night, your doctor is usually sleeping at another delivery, at another hospital. Your doctor usually has clinic hours during the day, 9 to 5, typical hours, and then they're delivering babies at many hours of the day and night. So when you ask, when is my doctor getting here? Or is my doctor gonna check me? Or what did the doctor say? Sometimes we didn't call the doctor yet, or sometimes the doctor is sleeping because it's 2 a.m. So those are just some things to keep in mind. We try not to be rude when we're relaying this information, but we like for our patients to know these things.